done clinical research studies and authored multiple academic publications. A passionate educator, he has received numerous degrees. And today he is with us talking about various of his expertises, and he's actively contributed to multiple studies across the nation. So he's also won 12 consecutive Teacher of the Year awards. And he's currently completing his thesis towards a Master of Health Professional Education degree, which is a MPHE degree. And he's also part of the ACCP's Diversity, Equity, and Inclusion Council. Please join me in welcoming Dr. Bhavin Dalal. Welcome, Dr. Dalal.
Thank you, Prashanti ji. Thank you, Hema ji. And thank you, everyone, for joining. A very good evening. Yes, it's a little late in evening. And the topic today is sleep well, live well. But at least I promise that for this hour, I will not let you sleep with several interactions during this seminar or webinar. Initially, I thought that this is only for the dynamic women. Looks like there are a lot of men have joined as well. And I thought this was for the people from the Michigan or a Detroit area, but looks like there are people from other parts of the country as well. So thank you everyone for joining and welcome.
Bhavin, Dr. Bhavin, I have just one suggestion. Also, if you can mention about how our children and youth, also that is important for them. So these parents can, share your lecture with them. Thank you. Your information. Thank you.
Sure. Let me complete this one and then I can tell more about it. I'm in one of the ad board, but I don't think that the current lecture has any disclosure. You can see that what we need to do from this cartoon diagram. In today's lecture, we will try to talk about the normal sleep habits. We also consider that as a sleep hygiene, list the consequences of a sleep restriction, and finally review some common sleep-related myths. With that, I have this interaction, and if you guys have joined on the computer, you can open another browser. If you are on a phone, you can again open another browser and type this website. Okay, hold on a second. So you can join here. Either you can look at this one, the www.classpoint.app, and then it will ask you to use the code. So put the code 89555. This is only one time you need to do. After this first time, every time it would be the same. So again, it's a classpoint.app.
And that link is in the chat. So
that link is in the chat as well.
Just click on that.
You can type, in that space that what is the most important sleep problem you have, or anyone you know they have a sleep problem. Can you write something there?
So for me, it says that the name you have entered does not match the list defined by the presenter.
Yeah,
oh, that's what it says.
Oh. Yeah, that's what it's saying to me too.
Oh. Okay, you can put it in a chat box. What is your most common problem? What do you think is the most important problem you know, or you know somebody else? You can put it in a chat box. Okay. Falling asleep, irregular sleep pattern, waking up in the middle of night. I think we will talk several of these problems you mentioned. The sleep is a very important problem for the healthcare providers in general. And you can see that in this particular graph, since the 1999 onwards till 2000, the number of the patients who are coming to the primary care doctor for the insomnia, which is not able to sleep, or any sleep related problem, the number of visits are significantly increasing. Even when I did my fellowship back in 2009, compared to that, we are currently seeing so many patients with the sleep problems, especially younger patients, what Hemaben was saying, and I will address that eventually as well. Those patients are significantly increasing, and we are quite worried in the in a sleep practice or being in a sleep academy. This is another cartoon diagram or a graph shows you the data from the 2010 to 2018. And this on a y-axis, we can see the percentage of the people. The blue are the men and the orange dots are the women. So you can see that in men and women both, in a last decade or so, the number of the sleep problems have significantly increased from almost 30% to 40%. So this is a rising trend for the last 2 or 3 decades, and we are all worried that we need to do something about the sleep problems in general. And I believe such a kind of activity will probably help us in general. So I have again a question, and then I don't know why that app doesn't work, but we can just put the answers in the chat box eventually for the every interaction. We have like Hemaben was saying, that the talk about more about the children. I think I just have an example about the one of our children somewhere. I'm pretty sure that this is very familiar, and I'm very sure that this is very known vignette or the situation. uh, One of the mother came to us with the daughter, 17, 16-year-old daughter, and daughter is on the phone for most of the time on a social media or something, and not talking to the family significantly, was lonely and stays in her room. Her bedtime was around 12 midnight and wakes up at 4 a.m. Wake up time is around, in between wake up time around 8 a.m., sometimes 1 p.m. So anywhere between 12 to 4, she sleeps. Anywhere between 8 to 1, she is waking up. And then she had quite a bit of an irregular sleep hygiene or a sleep cycle, which several of you mentioned. So I'm going to shut down this one, but you can put the answers in a chat box. Which of the following is likely to be true combination about her sleep time and the grades? One of the common excuses the kids are giving is that, daddy, I need to work. I need to work, and I have to finish this assignment. So that's why I'm awake at night. That's a common excuse. At least I have heard from the kids several times. So what do you think about the sleep time and the grades? Decrease sleep time, decrease grades, decrease sleep time, increase grades, increase sleep time, decrease grades. What would be the correct combination? You can put the answer in the chat box. ABC, whatever you think is the correct answer. Right, several people are saying that the decreased sleep time is associated with the decreased grades, and I think this is very well known from the so many studies in the medical world we have done. that the high school students or college students who sleep for longer than 7.5 hours or 7 hours at least, they have a significantly better grades in their exam compared to actually the people who do not sleep. So very well proven fact that the decreased sleep time, at least for the kids purposes, it decreases their grade. The another term which emerged in the last decade or so is known as a problematic internet use. And I think all of us are actually victimized with this particular situation, because now we do not have any pattern or any work time or the relaxation time. Everything is kind of lumped up with a significant internet use, and it's irresistible internet use for the significant amount of a time during the day or the night. That's what is known as a problematic internet use. Again, several studies, the psychiatric studies and medical illness studies, for example, in a white clear box we have a crude prevalence meaning by overall how many percentage of the people in the society or a population what they studied have that problem. EDS stands for the excessive daytime sleepiness. So the people who are not addicted to the internet, and this is a comparison, the people who are addicted to the internet. So the people who are addicted, they have almost 40% people who have excessive daytime sleepiness, and people who are not addicted to the internet, they have only 7% of the excessive daytime sleepiness. So those people who are addicted to internet actually feel significantly sleepy during the daytime. That's what the meaning of this simpler study was. Similarly, in this study, they compared the people who have internet problems, and along with the internet problems, what are the problems? For example, they have sleep problems, they have a loneliness, they have anxiety, they have a more depression, and that was very much correlated with the amount of the time they were online. So this includes the cell phone or the laptop, or every type of internet usage was associated with significant psychological problem in the kids, in the adults, in like almost every population nowadays. We can say that. So this is a very important problem which compromises the sleep. So I'm not sure whether this cell phone is one of the best instrument designed, or actually it's a significantly a problematic instrument. And apart from sleep, there are several other problems, and we are not going to talk about that today, but definitely creates more and more problem. This also increases the usage of the sleeping pills, increases the poor quality of sleep. It causes more insomnia, meaning by not able to sleep, increase the sleep latency, interrupted sleep, or people just wake up again and again, and finally decreases the sleep time. So all these things are actually creating a problem. I will again stop this one. So I have a question again for you, which you can put in the chat box, that what activities do you do in a bed prior to sleep time? You can just put something in the chat box, that what do you do in the bed or in the bedroom prior to sleep? Apart from looking at the screen or what else? Watch a phone, reading, book readings, Netflix. Wow, okay. Chanting and reading, nice. So I think there are a lot of activities people do in the bed and the bedroom. And this is again a question that all of the following can be a part of an abnormal sleep hygiene, except variable bedtime and wake up time, watching a TV in a bed, racing thoughts in the bed, if you are not able to fall asleep, having sex in a bed, or eating during sleeping time. In other words, everything else is not permitted except. You can again put in chat box. A and D, C, E. Wow, people have a very different answer this time. So we'll need to highlight A, B, and E. Yeah, I know this is a little difficult, phrase of a question, that what is not permitted on what is permitted. So I think the correct answer is the having sex in a bed. We have a textbook statement says that the bed in a bedroom is only for a sleep and sex. Everything else you do, for example, watching TV, even racing thoughts, the eating, is not actually permitted in a bed. That increases the sleep problem, and we'll talk about that just in a minute. The variable bedtime and wake up time also is actually not very healthy or not very helpful for the better sleep. So that also is not a good idea for the sleep in general. So that's a part of a sleep hygiene, and we'll talk more in detail. So as I just said, the only thing which are permitted in the bed is a sleep and sex. That's what our textbook statement says. According to the different surveys and the different studies in United States, almost 88% of the people, so you are not alone, 88% of the people watch multiple episodes of a TV show or the streaming services. More, including 95% of the people between the age of 18 to 44. So less old people, but the more younger people doing this thing, which is a problem. 66% of the people read a book. 60% of the people watch a sports, and almost half of the population plays video game in the bed or the bedroom. And all of those things actually cause significant sleep loss, which is not healthy. So how many hours do you sleep on an average? You can actually put the numbers in a chat box. On an average, again, the 365 days are never going to be the same. But if you hypothesize, if you just estimate how many hours, 5, okay, it's 4 to 6, wow, 6 to 7, 7. This is interesting. 5 minimum, max 9. 5, 7, 8 is rare, okay? 8 to 9, 2 to 5. Oh my God. Okay, average 2.5 hours. Dr. Pushkar joined from the New York. Thank you, Dr. Pushkar. Wow, this is again, according to the American Academy of Sleep Medicine guidelines, what should be the normal? I mean, this is what you are doing now. It is your time to probably understand, or if you know already, what is a normal sleep time? 5 to 6 hours, 6 to 7 hours, 7 to 8 hours, 8 to 9 hours. C, D, B. And I'm talking about a generalized population situation in general. Remember, by the way, the kids who are younger, for example, a 10-year-old kid may require actually more sleep, but we are talking about the adults. So I think the correct answer is actually 7 to 8 hours. That's what a recommended duration. And I will show you what happens if the people do not sleep for 7 to 8 hours. Every time I give this lecture, and again, I think that we are all from India originally. So people always talk to me and say that the Narendra Modi sleeps for 5 hours. And why are you saying that we need to sleep for 7 to 8 hours? So then my usual answer to that question is that, uh, do you have your wife with you? If the answer to that question is yes, then you are not Narendra Modi. So don't act like Narendra Modi. So then the normal people still need 7 to 8 hours of a sleep. So please understand that. That's very important part. Don't compare yourself with Narendra Modi. He's one in exception. Normal other people do require 7 to 8 hours of sleep. There are several myths, and again, I think you probably might have said, some of you might probably believe those things, that I am one of those people. I need only 5 hours of sleep and I'm good. That's it. I don't need more sleep. And that's probably again not true. Majority of the people do require 7 to 8 hours of sleep. If you don't sleep, there is a sleep debt. My son always tells me when he sleeps for, like 11 hours in a weekend sometimes, and he said, Daddy, I still don't feel refreshed. Because on a weekdays, he will sleep for 4 hours or 5 hours. So he created a 2 hours of a deficit or a debt every day. So then he has a now 14 hours of a sleep debt. And then he will sleep for 10 hours. The sleep debt is not caught up. Very simple. It's like a mortgage payment. You don't pay for the couple of months, the third month your mortgage will be more with the interest and the principal. The same thing happens with the sleep, and people definitely need to catch up before they feel refreshed. Again, several other myths and facts are that I will rather power nap, I will just sleep for an hour or half an hour, and I will be good. Yeah, you'll be good for the next hour and a half, but again and again, the over cumulative sleep debt is causing the problem, and that is causing the significant health problems. And some of the people are mentioning, but what can be the health problem? So that is where I think the money is, I believe. Actually, you name every single health problem in the body. For example, more heart attack, more stroke, more diabetes, more infections. Uh, any kind of the health problem you can tell me, and I will actually find you the paper. I will find you the study that the sleep deprivation is causing this particular thing. Of course, the common immediate manifestations would be short-term memory loss and a mood swings, and a lot of people we see in a clinic are probably wrongly diagnosed with either ADHD. Again, a common problem in the kids. Actually, Hemaben asked me to talk about the kids in between as well. It's a commonly important, a common misdiagnosed problem is ADHD and depression. So psychiatric manifestations are definitely more, but every organ system in the body is affected. This is another way to actually think the same situation, that the sleep disturbances or a poor sleep or the restricted sleep will cause every single problem, including cancers even. So a lot of people also ask, I don't smoke, I don't drink, I don't do this thing. How come I have a cancer? Do you sleep? And I think that is a very important part, that the people need to sleep. Now, if you want to lose weight, any one of you guys on the board, I mean, this group, type yes in the chat box. Kanan says yes, yes. You only want to lose weight once, but yeah, yes, yes, twice. And I think that's a very common problem, right? Everyone wants to lose weight. I believe so. And this is an amazing study they did in Australia. They actually admitted the patients in hospital. They have limited amount of the activities forcefully in a one time. I mean, this was a study for the 21 days twice. And as you can see that for the first 4 days, they were allowed to remain in the bed for 9 hours. For the period of the study, the red color, they were allowed to sleep only for maximum of 4 hours. And then there was a recovery period for 3 days where they are again allowed to actually remain in a bed for 9 hours. And then they did a crossover, meaning by this population, after those 21 days, again went for the second half of the study, the same people, and they again slept for 4 days in 9 hours, the again 9 hours for 14 days and 9 hours. So like this was a control part, in the bottom, meaning by they were not allowed, they were not sleep restricted. The sleep was normal. And this part, they were only allowed to sleep for 4 hours. So in a one time, in a 21 days period, they were allowed to sleep for 4 hours. In other time, they were allowed to sleep for 9 hours or maximum 9 hours. Majority of the people slept more than 7 or 8 hours, but not 9 hours. And this is what happened. Their calorie intake, while they were sleep restricted for 4 hours, their calorie intake increased by almost 300 calorie more every single day. Their overall weight increased by 0.5 kilo only in 14 days. By the remember, this is a 2 weeks of a time. Their visceral fat actually increased by 7.8 square centimeter, and a subcutaneous fat increased by 7.4 square centimeter. So on an average, the abdominal girth, your kamar size, increased by 4 to 5 centimeter. Just in a 14 days, the size of the abdominal girth increased by 4 to 5 centimeter. Good thing was that when they actually went in that control part, meaning by they slept again for 7 or 8 hours, that was actually restricted back to normal. So the people who really want to lose weight, they need to sleep. I think the one simple thing that the people need to sleep if you really want to lose weight, and that's very important part. This was a study, this was a study done in a 2010 by the New York Times economist. So they calculated the direct and indirect cost because the people do not sleep in United States. And then you can see that we paid around $411 billion, which is 2.2% of the country's GDP. And this was in 2010. So I'm pretty sure that if we do the same study today, there will be probably $1 trillion deficit every year just because people do not sleep. So imagine it's not only our own impact, it's the globally the whole community or the whole nation impact while the people are not sleeping. We have another fascinating study. You just saw that the normal sleep duration was supposed to be higher than 7 hours. So there was a study from the Apple Watch, because Apple Watch can actually measure the duration of a sleep, not exactly accurate, but reasonably okay. And then the only 23% of the United States people out of 100,000 people actually slept for more than 7 hours. So less than a quarter of a population is sleeping in United States compared to the normal recommended duration. So it's creating a significant impact, by the way, in general, in the health and the economy. Another case study or another case example that Mr. Maximus is a 55-year-old guy who is an office worker, has significant stress due to the losing his job. Possibly everybody's losing job in a current era, unfortunately. So he drinks 2 glasses of a wine. And I think I learned this new fact in United States that a glass of a wine every night is actually good for health. And we have debunked that statement in the world of medicine so many times. Smokes almost a pack of cigarettes. His job time is 8 to 4 p.m., 8 a.m. to 4 p.m. He runs on a treadmill. So this is a good guy. He does some exercise. Trying to sleep around 10:30 to 11, but he's on a phone, like a lot of you people mentioned on the chat box, for almost an hour. He's sleeping around 12 midnight. Sleep latency, meaning by once you close the eyes and actual time of a sleep, it's random, it's approximate, it's almost an hour of a time. 4 out of 7 nights he wakes up around 4:30 in the morning, and then he can go back to sleep even though he doesn't sleep too long. And a final wake up time is 6 a.m. And then he feels exhausted during his day, like all throughout the day. So what should he do? Just your logic. Again, these are the questions which does not require a medical knowledge. These are all the common sense question I have collected here. So change his sleeping time, stop smoking, stop drinking, stop exercise. What would be helpful for his midnight awakenings? Like 4 o'clock he wakes up. CD, some people are saying reduce the screen time. Yeah, probably that is good idea. Somebody said A. D, stop exercise. So I think the correct answer is stop drinking alcohol, at least for that midnight or the middle of the night awakenings at 4 a.m. And I will show you the alcohol has a significantly detrimental effect on a sleep quality. Alcohol has significant detrimental effect on a sleep quality. And that is dependent on the amount of the alcohol people drink. So even a 1 drink for a woman or a 2 drink for a man will reduce the sleep quality by 9.3%. 2 for men, 1 for women, 24%, and more than 2, almost like 40% sleep quality is reduced. One of the typical effect happens that the alcohol reduces the REM sleep. REM sleep is happens after the 90 minutes of the non-REM sleep in a periodic fashion as the night progresses. And the people actually do get awake in the middle of night and they cannot go back to the sleep. Also increase the sleep apnea. So then the alcohol has a significant bad effects on the sleep in general. And people want to definitely prevent alcohol on a daily basis. So this is the correct answer. Why the other answers are not correct? I mean, to change the time of a sleeping time to 9 and wake up at 4, people are probably not going to get a sleep at that time. So not very practical and possible. stop smoking will help the sleep onset insomnia, meaning by he will be able to sleep initially, but that the midnight awakening might not be helped. And stop exercise is also going to help the sleep onset, meaning by if you do the exercise or late in the evening, that will produce more catecholamines or the hormones, and that will keep you awake. But that will not help that midnight awakening. So that's why that answer was kind of a wrong. I'll just talk about these two common disorders. The the nicotine works for the brain stimulation, so that's why the smoking is preventing people to sleep. Dr. Patil is saying that. Yes, that's true. There are two very important sleep disorders. Again, we can't talk everything in detail, but this is a one very important disorder known as a sleep apnea or obstructive sleep apnea. Actually happens way more commonly in the Indian man or Indian people in general, for whatever the reasons, or the South Asian population, I will say globally. Uh, why does it happen and what happens in a sleep apnea? This is a little 1 minute video which will help you to understand. When we breathe, air travels down the throat, through the windpipe and into the lungs. The narrowest part of that pathway is in the back of the throat. When we're awake, muscles keep that opening relatively wide. But when we sleep, those muscles relax. That narrows the opening. The air passing through may cause the throat to vibrate. That causes snoring. Obviously, many people experience this. But in some people, the throat closes so much that enough air doesn't get through to the lungs. When this happens, the brain gets a message to wake up. The brain quickly activates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This only takes a few seconds. You may not even know you've awakened, but this process may happen over and over, hundreds of times, all night long. You may never get into the deep, restful stage of sleep. As a result, you may feel exhausted when you wake up and feel sleepy all day. Many mistakes and serious accidents are caused by sleep deprivation. So, sorry. So I think the apnea, meaning by you stop breathing and you stop breathing during sleep, that's what is known as sleep apnea. You understood the it happens due to the collapse of the airway. Now, they did not say in the video, but one of the important consequences happen because of the not breathing so many times, hundreds of the time, that your oxygen level will go down and up, which will cause significant torture on the brain, heart, and lung. So the people with a significant sleep apnea are almost 3 times or 4 times more likely to develop heart attack and 6 times more likely to develop stroke. I am seeing a lot of Indian patients who have a horrible sleep apnea, and that doesn't even come to the surface. So that's a very common problem overall, globally, as well as for us. And the second important problem is insomnia. Insomnia meaning by people are not able to sleep. Either they are not able to initiate the sleep, meaning by when they go to the bed, in the initial part, they are not able to fall asleep, or they are not able to maintain the sleep, meaning by they are able to sleep initially, but then after a couple of hours, they will be awake and then they cannot go back to sleep. So that would be a sleep maintenance insomnia, and this would be a sleep initiation insomnia. So those, and some people can have a both. They have a problem initiating and problem in maintaining the sleep. The best treatment is actually not medication. There are not a significant number of medications approved for the insomnia. The best treatment is known as CBTI, or a cognitive behavioral therapy for insomnia. Cognitive behavioral therapy for insomnia, known as CBTI. And again, you need a professional help for that particular thing. But I am going to give you like a 3 important tips, which can be translated to these 3 different words: the bedtime restriction, stimulus control therapy, and a good sleep hygiene. So the bedtime restriction, meaning by some people actually lie down in a bed, at 10 p.m. and then don't go back to bed at 12. So then in those cases, what you want to do is try to go to bed at 15 minutes for 5 to 10 days. So for example, if you are able to sleep at 12, try to go to bed at 11:45. for almost a week or 10 days. If that does work, then the next 10 days, try to go back to the bed at 11:30. So try to prepone the time. The other meaning of a bedtime restriction is that the people are in a bed for 9 hours, but they're actually sleeping for 5 hours. So that they are spending too much time in the bed and they don't want to do that, which leads to the next comment of a stimulus control therapy. This is what commonly people do ask us question. I am in a bed, I am able to sleep initially, but then I wake up at 2 o'clock and then I don't go back to sleep. What should I do? So this is the advice I give them, that they don't look at the time. So in the middle of night, you do not want to see the time. The once you see the time, like this is a 1 o'clock or 2 o'clock, and then you have to work next day, the moment you see the time, your brain will start the anxiety that, oh my God, I'm not able to sleep till 2, how I'm going to work tomorrow. That anxiety about insomnia, that anxiety about not sleeping will actually create more insomnia, meaning by you are eating your own tail. So please do not look at the time. Like if you have a clock on the table, move it around and then accidentally you don't want to see the time. So you woke up in the middle of night, you drink some water, use the bathroom, whatever you want to do for a couple of minutes, come back and try to sleep. And then if you are not able to sleep in next 15-20 minutes, which is an approximate guess because I'm not actually asking you to see the time. So, do not look at the time, which is an educated guess that this is the 15 minutes and you are still not able to sleep. Then go out of the bed, go out of the bedroom, do something like go in the living room, go to the kitchen, don't start eating, don't turn the big lights, the dim lights, and do something what you don't like. Once you feel sleepy, then you actually come back to the bed immediately and sleep. Now remember, no screen time, no watching TV, no laptop. So what you want to do is something like on a pen and paper, something which is boring. If you don't like to read the chemistry book, read the chemistry book, or if you don't like to do a puzzle, do something that. And then as soon as you feel sleepy, your eyes are a little drifting, then you come back to the bed and then sleep. And last part is known as a good sleep hygiene. So this is a very important diagram or the picture I am going to show you what people should do in a bed and a bedroom at a different time. So for example, the most important part is a stick to the schedule. You need around 7 to 8 hours of a sleep. Again, 365 days are not going to be the same. I try to keep my schedule more or less same for at least 300 days. Remember, when we sleep, there are several hormones are released in the body. For example, melatonin. When we wake up in the morning, for example, the cortisol is a hormone which is released. So we have, the significant cycling phenomenon in the body at a different time frame of the day and a night. Different hormones and different chemicals are liberated in the body. Now, if you sleep one day at a 9 p.m. and one day at a 12 p.m., if you wake up one day at a 4 a.m. and then the one day at a 8 a.m., you are confusing your body significantly. Body doesn't know when the bhavin is going to wake up and then the bhavin is going to sleep. So when to deliver this hormone, that will be completely chaotic. So people without any single sleep disorder, just because of the irregular schedule, they will have a problem, a significant problem with the health. Second, 6 hours prior, you want to avoid caffeine. Siley was asking me that if I want to drink coffee before this lecture, and I said, no, absolutely not. If I drink coffee now, then I won't be able to sleep till 2 a.m. and then that's a problem. I'm working in ICU, so I don't want to drink coffee in the night. Also, I hear another statement that, I used to drink 4 cups of coffee and I was able to easily sleep. Remember, the caffeine metabolism goes down when we get older. When I was 25 years old, I could drink 2 cups of tea, the Indian tea, and I used to do that. I was able to sleep, but I couldn't do that now because, I'm now drinking a 1 cup of a tea in the evening, then I can sleep till 12 midnight. So caffeine and tannin metabolism goes down when we actually get older. So avoid at least caffeine, chocolate, alcohol 6 hours prior. Avoid heavy exercise 3 hours before the bed because, as I just said, that will cause the release of the catecholamines or the active hormones, and that will not allow you to sleep. 2 hours prior, avoid big meals. So the sugary things avoid, and then they avoid tobacco if the people are smoking. I think in our community that problem is a list, which is thank God. Which is very helpful. And then the last hour, you want to avoid the screen time. American Academy of Sleep Medicine guidelines says that the people need to avoid a screen time at least an hour. I will say hour is very difficult in a current era, but I try to avoid it probably for 15-20 minutes or half an hour if possible. So this is caffeine metabolism, and then this is a kind of a little help in general. What you want to do, make a plan, like you can have a sleep diary, or you can have a sleep schedule, or you can have the sleep rituals, whatever you say. And those who have a problem, you can always bring it to the sleep physicians. This is another simple mnemonic for the screening purposes for ourselves as well as for the patients in general, that do they have a problem with the bedtime? Do they have excessive sleepiness during the daytime? Are they awakening again and again? I think a lot of people mention this kind of problems in the chat when I asked the first question, that what are the common sleep problems? Regularity of the sleep and sleep disorders, including sleep apnea or the insomnia. And so this would be like a BEARS would be a very easy mnemonic for screening ourselves, our kids as well. And with that, I will say thank you very much for paying the attention and spending your precious, sleep night actually with us. I prevented you to sleep for an hour, so I apologize for that. But I'm happy to answer actually any question.
Thank you, Bhavinji. I do have few questions here in the chat, apart from, thank yous for you on this important topic. And the first one I think is, how would nicotine affect on brain stimulation?
So the nicotine is a stimulant substance, actually. Nicotine receptors or the nicotine will cause, it's basically a type of the catecholamine type hormone. So that is a brain stimulant, and that's why it will keep the people awake.
Okay, the next question is, how about any yoga exercises for sleep apnea? What are your thoughts?
Purely for a sleep apnea, there are exercises. For example, the people have actually tried the studies for the neck exercises in a different way, like trying to extend the neck. That may work only for a mild sleep apnea. So depending on the severity of sleep apnea, for example, if you stop breathing below 5 times in an hour, that is considered to be normal. Between 5 and 15 times every hour, even though it seems too much, actually it's a mild sleep apnea. If someone stops breathing between 15 to 30 times, would be moderate or a grade 2 sleep apnea. And somebody who stops breathing for almost 30 times every hour will be severe sleep apnea. So the exercise may help the people if they have a very minimal sleep apnea. But remember, the sleep apnea has a linear tendency with the weight. So heavier we are, more sleep apnea, and age. So older we are, more sleep apnea. Men are in general more likely to develop sleep apnea compared to women, but women after the menopause actually are equally affected like the man with the sleep apnea. So there are several other factors other than just the tone of a muscle, which we can improve, but everything else we can't. And so that's why the prevalence is increasing when we get older and older.
Do you think the use of cannabis would help?
No, I saw, and I intentionally didn't want to talk anything about it. There might be, the people are saying that the oral cannabis can be helpful for the sleeping, but we don't know what it costs. Meaning by there might be several harmful consequences in the body, and we don't know answer to that question. So or at least I don't recommend people cannabis just for the purpose of sleep. Also remember that anything you do, including cannabis or any other medication, that's why the American Academy of Sleep Medicine Society has not recommended significant number of medications to be used for a longer time, because by default the sleep has to be natural. Anything you try to induce the sleep unnaturally it's not going to work for a longer time. Even it may work for a week or 10 days or a month or maybe 2 months, but eventually it is not going to work. So then I will strongly say you don't want to do that.
Absolutely. And a follow-up question on that same thing. How about magnesium or ashwagandha, which is familiar among Indian population?
Magnesium, I think that we have a couple of studies that might induce the sleep or improve the sleep quality rather than the sleep itself, like rather than inducing sleep. Again, I don't see significant harm in taking magnesium. Like you take a 1 magnesium tablet at night, I don't think that's a very harmful. So whether it helps or not, at least it's not going to hurt. So then that's fine. Again, I'm not recommending anything here. Just understand that. I don't know actually anything about ashwagandha. As far as the studies or the evidence-based medicine is considered, I am not aware of the ashwagandha and sleep.
And I agree on that point too. Definitely related to ashwagandha. And I know there was a question about I live alone, and how do I know if I snore or I have sleep apnea?
Uh, if you don't snore, I think the other question need to be answered. For example, do you feel refreshed during the day? Do you feel tired during the day? Sometimes the apneas, they last longer. Our definition of apnea is only 10 seconds, the stop breathing for 10 seconds. But if somebody stops breathing for 15 seconds, 30 seconds, they are going to actually wake up themselves, like by choking or gasping. So if you have those situations, then probably you want to seek, medical attention.
Obviously, and I know there are questions coming about how do that 7 to 8 hours count? Is it like, being awake, the REM, the different cycles of sleep? Do you have anything to add on that amount of time? How do you measure?
You can change the time of a stages of the sleep. The only choice we have as a human being is a total time of a sleep, if possible. Also, in older people, that's even a less of a choice. They sleep probably little less than 6-7 hours. So, like after the age of 65, 75 or so. But you can't decide the stages of the sleep. And when we get older, the deep sleep, so the sleep is divided into the non-REM sleep. So in that case, the eye movement doesn't happen, which occupies around 70% of the sleep or 75% of the sleep, and a REM sleep. So during REM sleep, people have a movement of an eyeball. Actually, even though we are sleeping, the eyeballs are moving. If you have observed the kids, sometimes the kids' eyelids are open and you will see that the eyeballs are moving. That is known as a REM sleep. So REM sleep in general occupies around 20 to 25% of the sleep. And in a non-REM sleep, it is superficial sleep, mid sleep, and a deep sleep. So when we get older, unfortunately, the deep sleep goes down. That's an aging phenomenon, and we can't do anything about it. There is no medication that brings more. On the other side, all the medications, for example, most of the antidepressant medication, antipsychotic medications, mood elevators or mood suppressors, benzodiazepines, like, commonly, I've seen a lot of Indian people take Alprax from India. We don't prescribe it here, but they will bring it from there. And then people use those medications that will suppress the deep sleep, that will suppress the REM sleep. So those are actually causing more problems with the sleep than helping.
Perfect. Thank you. And I think for the women in the group, they want to understand what are some of the best practices that you would suggest to improve sleep during hormonal imbalance. And I understand that's either pre or peri or postmenopausal.
I think that, the hormonal replacement therapy has shown to improve the sleep, improve the hot flashes. That's how the postmenopausal women kind of wake up. But again, comes with its own cost. There are side effects of the hormonal replacement therapy. Fortunately, in the newer, and again, I'm not the gynecologist or the OB/GYN person, so I cannot say. But as far as the sleep part is considered, if we are trying to improve something, we have to make sure that we are not messing up the other aspect of the hormonal replacement therapy. Uh, what we suggest and recommend that at least the factors which are not in our hand, like, natural factors are natural factors. We are all going to get aged and going. It's a continuous process. We can't change that. but I can change how much screen time I have. I can change at what time I should go to the bed. I can change what should I do. Like my phone in a night time goes in a complete silent mode, except when I'm working in the ICU for a week of a time. Other than that, it goes in a, like if the whole earth is going like whole, the world is going to crash, I won't know, because I have to protect that sleep time. That's my choice. So that is in my choice. Everything else is not in my choice.
Absolutely, well said. And I think that goes in line with, a couple questions that line up with like, what should we do to fall asleep quickly? Again, I think those routine timings, things which you should do, which you should not do still matter, I think. Do you want to add anything else, Bhavanji, on that?
No, I know somebody's asking that the left side versus the right side. I am not aware of any study which is, showing me an
Mhm.
impact of a positive sleep on a left or a right side. You don't control anyway the side once you sleep.
And same with breathing techniques and other things that
Yeah,
show up on social
some
media.
of the some
Mm-hmm.
of the breathing techniques has been shown. Again, like when we ask our patient who have a horrible insomnia, they are saying that those doesn't work. But like there is a technique. For example, you count you take a deep breath, count for 1 to 4, then you have a little holding of a breath like a box breathing type, and then you count down again and slowly relax or slowly release the breath. You try to actually relax your body, which is known as a relaxation technique. So you start from the toes, the on the bottom. So like you clench it significantly and then release, and then they try to contract each group of the muscles in an ascending order. So from toes and ankles to the knees, and like come proximal, meaning by to the thighs and the hand muscles, and then try to relax. It can sometimes work. Try to focus on this deep breathing can sometimes work, but don't spend too much time on that. I know, like I had a patient, and somebody mentioned in the chat box as well that I do prayer, and I had a patient who used to pray for 2.5 hours in a bed. He said, I told him that you shouldn't do this one, and he said, no, this is written in Bible. I said, no, I am not disagreeing with the Bible. The bed is not a place to pray for 2.5 hours. You go to the prayer room and pray for 2.5 hours, and once you are ready to sleep, then come to the bed and then sleep. Yeah, so 2-3 minutes, 5 minutes of prayers are good, but then you don't want to do those things that, okay, I'm doing breathing exercise for an hour. Then you won't get a sleep. Sleep has to happen. It is passive and it has to happen. So anything you try to induce it with active mindset that I want to induce sleep, it won't happen. I always say that the sleep is like love. It has to happen. You can't induce it.
Absolutely, well said. And again, I think, it's the regular habits and your practices. And again, does a shower help in getting good sleep? Yeah, go ahead.
Possibly, yeah, possibly. And again, there is no significant harm in doing that. So that's fine. Little, not the very warm water or the hot water, maybe a little slightly colder or that water.
Perfect. And I know we're getting to the close of the hour. And as Bhavinji said, we do not want to affect your sleep schedule today by being too late. And again, I see some comments very interesting and informative. Incorporate many suggestions. Again, I think, it depends on your personality and your habits and, the regular practices that you've been doing as a kid, adult, and based on your profession too. I think there are some healthcare professionals who just have to moderate their sleep in a way that works with their schedule. So we advise you to follow those prescribed schedules that work for you and go from there. So definitely a habit will make sure that you are able to sleep in a prescribed way. So saying that, I'm going to thank Dr. Bhavin one more time, and Hemaji and Seliji, if you guys have anything. I know next week is Thanksgiving, so we wish you all a happy Thanksgiving. Spend time with family, relax, de-stress, do all that you could do for a better living, and treat your own self, and make sure you pat on your back and say that you deserve a break. And I will have Imaji speak if she has anything to add for the next sessions that will be coming up in a couple of weeks.
Yes, thank you very much, Prashanti, you are the great moderator, and it gives the right direction for the speaker what to speak next and all. Thank you, Dr. Bhavin Dalal. That was very, very common topic that we never pay attention. But I hope all the people who is attending got some information. And thank you all the attendees that your class attendees today was constant 47. There were 53 left, but 47 is there from the beginning until last minute. Thank you, Saili, for taking care of all the attendees coming in, and the technical part is very important. And sorry, I'm in Phoenix, Arizona, and thank you for taking care of it. Now the next, some of the speeches we are having it for the fatty liver by Nisha Chalam, and the bladder problem for women by Dr. Salil Khandwala, and yoga poses for those kind of things. So mostly those will be women. So moms, if you want to have your children again for fatty liver, and girls for the frequent urination and all that, sometimes they're born with the hereditary. So I just wanted you to join and support our inspiration, and that's good for you. Thank you very much. Thank you.
Thank you, Himaji, and thanks for your dedication. No matter where you are in this part of the country, you're always there, committed to getting these done. Thank you so much. And
thank
we
you,
will end
Agnes.
the
Yes,
call.
thank you.
Thank you, everybody. Have a good night.
Yes.
Thanks.
Yeah, good night. Yeah.
Thank you, everyone. Thank you, Himaji. Bye-bye.
Bye-bye.